So I'm Emily Viverette. I'm the Director of FaithHealth Chaplaincy and Education at AtriumHealth Wake Forest Baptist. So in that role, I work with our chaplains across our 5-hospital region to develop spiritual care programming for patients, families, staff. So part of the role is working to make sure that our patients have the spiritual care resources that they need during difficult times, which is, pretty diverse population in the Association of Clinical Pastoral Education. So we run a training program for local clergy and divinity school students and students of all faiths that come through to learn more pastoral care skills or spiritual care skills. So we have, diversity of perspectives coming into that program as well. And the other piece of my job that's really exciting is the expansion of spiritual care beyond the walls of the hospital, like in the community. So some of our chaplains, particularly at our smaller rural facilities, do a lot of work building networks and partnerships with congregations, faith communities, and faith-based agencies to help improve access to care in those areas. Our department has done for the past 10 years is there is something called Safety Huddle or daily safety check-in at our institution every day, 7 days a week. And chaplains early on were only asked to bring kind of an invocation, an interfaith word, a centering moment on Mondays. Well, during the pandemic, we were requested to begin doing that daily. So this became a time for hospital leaders. This is like all clinical leaders across the whole institution come together for an hour to talk about safety concerns. And at the end of that hour, we were asked to offer a word of encouragement, a prayer, and invocation. And those needed to be pluralistic and inclusive. So that's one example of how kind of spiritual focus has helped our institution and people in our institution through the pandemic. We've done some work in our institution in engaging faith communities to provide care for patients post-discharge that needed help. Faith communities love helping people. And we discharge a lot of patients that could use a little extra support. So for example, the An-Nur Islamic Center we engaged, and they had several members in their congregation that owned restaurants. And we set up a program where there were patients who were discharged that had a hard time getting meals for like the first week post-discharge. The An-Nur Islamic Center would bring hot meals to patients who discharged. And they would bring meals to anyone of any faith. It wasn't particular to that particular faith community. So that's one example of engaging faith community networks. We had a patient who was inpatient. When she came into the hospital, she was able to walk, but her health condition deteriorated to the point where she was no longer able to walk and she needed to go home, but she didn't have a wheelchair ramp, she didn't have access, and there was nowhere for her to go. So her physicians called our office, FaithHealth Chaplaincy, and said, "Is there anything y'all can do?" And we said, "Well, we'll look into it." And there is a ministry that the Baptists offer, which is building wheelchair ramps. So they volunteered to build the wheelchair ramp. This patient was not Baptist, was not a member of any particular faith community. The physicians, the department paid for the supplies. So the ramp was built, the patient was discharged, and with her permission, and it was just a beautiful opportunity. Well, I think one of the challenges and the pandemic really highlighted this, is that religion has become a wedge issue and a political issue in some communities, and we have some rural areas where smaller congregations that are less trusting of institutions, for very good reason, less trusting of institutions, didn't want to be vaccinated. There were churches that were involved in publicly, proclaiming against vaccination. There are different religious beliefs that feel really threatened by difference. So trust is such a huge issue. What I do find is that if people get to know each other, trust can be built. I mean, one of the gifts of the training programs that we run is we bring diverse people in. I mean, we've had people on opposite sides of the theological spectrum be together in a group and learn to respect each other. But that's long-term hard work. It doesn't happen automatically. So I don't see any better justice work right now than helping people have access to care and helping people to really be able to fully live into, who God or the great mystery calls them into being. So I get to do that by working with faith leaders who are growing in their own skills. I get to do that by working with wonderful chaplains who are really can be very prophetic in their roles and helping point out to institutions where they can do their work better. So it's a real gift.